I'm Debbie Goodman, and this is Dr. Diego and Debbie. I'm here at the Allende Center for Regenerative Medicine and Vitality. What are we doing today, Dr. Allende?
Well, today we're going to talk about the who, what, when, and why of IV therapies, other known as intravenous therapies or treatments.
Okay. Are you going to stick me with something?
Well, we're going to demonstrate, but I'm not going to stick you unless we need it because remember, it's the who, what, when, and why, right?
Okay.
Right. So why don't you ask me a little bit about who?
Yeah, who? Whoa.
All right. Well, I'm going to tell you a little bit about it. So a lot of different people can be candidates for intravenous therapies, and so what I like to do is try to screen my patients out based upon necessity or what they're looking for in particular. Usually I have a patient that may come in here that's worried about a malabsorption issue they've had before because they have problems with their intestines and they've had it for years. Sometimes you see these in patients who are on medications, everyday medications, things like antacids, things like what they call proton pump inhibitors because they inhibit gastric acid formation and therefore people can have difficulties with absorption of things like B12 and ferritin, which is iron rather, and then also issues with malabsorption of other nutrients. And so what we like to do is take patients into consideration who may have those conditions, but it could be for every everyday person who may be sick or ill and they can't take enough fluids in. Say they've had a viral syndrome and not been able to hold any foods down or fluids down, and as you know, the worse you feel, the more unlikely you are to take any fluids or any food. And so what we'd like to do is, we can hydrate people that way, and we can deliver nutrients that way. And usually we try to screen for our patients out, but that's really, we're looking for people who may have a malabsorption issue or a reason why they're not taking adequate nutrition internally. And so we're able to give them a supplemental treatment with an IV therapy and various different things we can give them as well.
Okay, so now the what?
Now the what? So, for instance, I may have patients that come in here who are undergoing chemotherapy treatment for a cancer. And sometimes I may have an oncologist that they're seeing somewhere in the state where they want them to get intravenous vitamin C therapies. And they take vitamin C therapy as a very strong antioxidant. Basically, it's an oxygen-free radical neutralizer. And so we take that to neutralize because in the process of chemotherapy, patients are usually being overexposed to oxidative agents. Oxidative agents create lots of oxygen-free radicals, which by nature cause a lot of damage to our DNA and our body, causes inflammation. So the idea is that they get their treatment, and then they may be referred out to us or back to me, and we may be able to give them intravenous vitamin C doses to help neutralize those oxidative stressors. And in those cases, sometimes we give patients 10,000 milligrams IV, 20,000, 30,000, as much as 50,000 milligrams IV. And that can be delivered actually very quickly or very slow, depends on the patient. And usually there's no side effects, it's very good treatment. Other options are for patients like I said, they have a malabsorption syndrome, maybe related to having had gastric bypass, or having a malabsorption issue related to, as previously stated, overtaken of antacids or a acid suppressing medication, and so they may be poor absorbers. And so sometimes we give people basically iron therapy infusions, and usually we do that in an oncology office because they have sometimes side effects of those treatments. And I don't necessarily do those, but I do other things like vitamins like B12 and vitamin 1, 2, 3, folate, cobalamin, which is B12. We can give magnesium and calcium, all kinds of good stuff to help restore what is missing in our patients' bodies. On other occasions, we may give it to patients who have liver toxicity or problems with liver function, patients who have fatty liver disease, patients who may have syndromes where they've over-abused certain medications that have caused damage to the liver. So we can give them things to help cleanse the liver like glutathione to help support detoxification and neutralizing agents. So we're able to deliver glutathione. We're able to deliver things that are precursors to glutathione, things like N-acetylcysteine. We can do that way also. We can give a variety of cocktails of different vitamin supplementation too. And so I may have patients who have chronic migraine headaches who don't respond well to typical therapies or don't want to take regular medications that we have for migraines these days and may want to do something alternative. In those cases, we can sometimes do riboflavin, which is vitamin B2, and magnesium sulfate, which has been shown to dramatically improve or actually abort headaches in patients too. So there's a variety of reasons why it's for that type of patient that may come in looking for that type of treatment. But the typical response is I have patients that come in, low energy states, fatigue, tired, not getting enough nutrition.
Mm-hmm.
And I think I always have to reference back to that our absorption issues. And when we measure bioavailability of nutrients, most of us at our best day absorb only 40% of stuff in our diet.
Hmm.
We lose a lot of the nutrition in our diet. So if you weigh that against a really good, that's a really good day. Okay, on a bad day you may get half of that.
Wow.
So you're taking a lot of nutrition if you're not getting as much out of it as you need to for various reasons. As opposed to an IV, you get an IV with a bunch of vitamins and nutrients, and that's 100% bioavailable.
Hmm.
So, in some cases, you can see it can be very beneficial to some people, especially if they're dehydrated, low energy, and need a boost pick me up. Maybe they're recovering from a viral syndrome and they need some vitamin C and some vitamins just because they haven't been eating or drinking enough fluids. They're obviously nutrition deficient, and sometimes we do it for patients like that as well. And on the occasion, you get the person who's probably partied a little too much, wants to come into through their recovery IV. And patients always ask me, what is that? What's a recovery IV like? For the most part, it's a lot of basically fluids. You're getting a lot of fluids because most people are dehydrated, and the hydration alone can make you feel better. But I'll put a whole cocktail, what we call a Myers cocktail, which is basically a combination of B vitamins, magnesium, and calcium. We get some other nutrients in as well, mixed in with vitamin C, and those all help restore the nutrition that you may be deficient from, say, a heavy weekend of having a good time. And then there's the patient who comes in who wants to do an anti-aging effective treatment. You just cannot get any supplementation into your body at high enough levels. And so I will get consultations sometimes for patients looking for nicotinamide adenine dinucleotide, which is we call NAD plus treatments. And that is basically a supplement which is a vitamin B3 analog. And that vitamin B3 analog is very important for oxidative reduction reactions in our body. And people ask me, what does that mean? In the process of transferring energy and creating something that passes energy to the next molecule to create a cascade of events so we can have this whole, like I have lots of energy thing going on in our bodies, we have to have oxidation reduction reactions on a continuous basis. Okay? And some nutrients like NAD help support that transfer of electrons. So oxidation, reduction. So they transfer the electrons downstream. So they're oxidating by taking it away and transferring it, causing reduction. And they continue to do that to create a higher energy charged particle that creates energy for us in the end.
This is something that I think I would be interested in. How often would I need to have this done?
It depends. Let me give you a scenario.
Okay.
Sometimes I have patients who do a little reading online and they want to reboot. And that reboot means something in the anti-aging world. And so when you do an NAD reboot, usually means you want to come in for basically about 7,500 milligrams of NAD over a certain time frame. That's usually about 10 days long. So you do 5 IV treatments one week and then follow by another 5 IV treatments the following week. They're about 750 milligrams each time. Now, that usually requires about between 2.5 and almost 3 hours treatment each time you get it because NAD treatment is a little bit, because it's a vitamin B3 analog, and if you have any experience with vitamin B3, it can make people flush because it's analogous with the niacin effect. And so although it's not niacin, it's an analog of that vitamin B3, it can still have that internal flushing effect, and people can feel a little strange from it, like a little flushing on the inside, a little woozy, but they always state they have tingling in every finger and toe on their body from basically the energy reaction they're getting. And because of that, I like to deliver it slow. And if you don't because if you give it fast, sometimes people feel nauseated too, and that's not the whole point. The whole point is to make you feel good, but to enjoy the treatment.
Okay, so let me get this right mathematically. 5 treatments per week?
Well, if you're going to do your reboot, 5, but I have patients that come in and they want to do, hey, just give me 500 milligrams today, and I'll be back in a few days and do another 500 milligrams. Or I have some patients come in 500 milligrams every 2 weeks. Or I have patients that come in every month and get it because they want energy, they want to have decreased pain, or they're trying to do away with their withdrawal effects from drinking alcohol all weekend.
No, that's not my problem.
Right. I have patients that come in, and if you think about conditions such as withdrawal is a low energy state of the brain. Okay, and so some other conditions that liken to that are things like ADD. And so you have some parts of the brain have low energy states in them. And so when you give somebody NAD treatments, you give them an abundance of basically energy ability in their body to make energy with.
Mm-hmm.
And so that can do away with a lot of the counter effects we see of patients going through withdrawal or addiction symptoms.
Okay.
But it also, in the same regard, can improve people's energy states who are in low energy states. And the correlation is this: as we get older, we make less NAD. And that's related to our inability to be as efficient as we were when we were younger, just like everything in us. That's why we age.
Mm-hmm.
Okay? So when we can restore it, we can return the energy back into the cell and regenerate things in our cell that make it more efficient. So NAD can also work as an enzyme to transfer that electron, but also provides energy, raw energy also, to certain enzymes in your body, which we call the sirtuin gene producing enzymes. And sirtuin means basically that it takes and fixes stuff in your body, particularly things like DNA,
Mm-hmm.
so it's not damaged, and repairs it. It also provides energy to produce and regenerate your mitochondria in your cells. Mitochondria are the motors that exist in our cells. And those motors need overhauls every once in a while, or they wear down, they stop working over time, right? And they
Mm-hmm.
age. So they age and they eventually become less functional, and then the cell has to have energy, otherwise it ceases to function. The cell becomes either what we call senescent, non-functional, or dies. And we want other cells to die or be functional. We don't want them to be senescent ever.
Okay.
Senescent cells like that, it's that, that really toxic neighbor, the one that's just bad news.
Yeah, I had one.
And then they keep spreading that energy, and they kind of irritate all the rest of the neighbors. You know what I mean? So that's what a senescent cell is, and you have to get rid of it.
Mm-hmm.
You have to get rid of it, or you have to basically regenerate it. And so NAD gives you the ability to basically to transfer and create more motors inside the cell. So you bring the cell back to life. You make it regenerate and vibrate again. And so that's where NAD is pretty phenomenal for regenerating stuff, producing more energy, but it also helps in these low energy states we see in patients. And sometimes I get patients that come in, who are suffering from, like I said, from a withdrawal state, and they don't, basically, they just want to feel better.
Right.
They don't want to go in recovery, through a recovery program, but they just want to feel better. And I could take, and this is not a medical cure, okay? But it'll take symptoms away from patients, and a lot of them who are having these withdrawal symptoms. And it's pretty remarkable. And I see patients come in here a few times a week, and then they're done. They don't need to have it again. It's pretty amazing treatment. But again, and that is a regenerative treatment. Most patients don't have to do it 10 days in a row. That is more of a reboot. And people do that, they usually feel fantastic, super full of energy. They're good for 3 months at least. But I have some patients that come in every 2 weeks or once a month, and they feel very good for at least 2 weeks. And so one could argue maybe they don't need to come in that often. And I have patients that ask me, well, doc, I can't get in here every month, but I really like how that makes you. How can I maintain those levels? And there's ways of doing it. Like we can get them, we give nasal spray, and we can also get some droppers underneath the tongue, and which can help maintain levels a little bit higher, but it's nothing like IV, because IV is 100% bioavailable.
Okay.
So the whole point of the IV therapies is to restore, provide additional support and recovery, and it may be something that most people would enjoy and benefit from if they had a specific reason for it. The only reason I tell people is, like, if you're going to come in, you're concerned about its deficiency, maybe we should do some pre-testing and see if you've got any deficiencies in particular we should be working on to make sure we add those into your treatment. The other thing is, if they're going to do vitamin C, we always have to check for some enzyme deficiencies, or otherwise you could induce a hemolysis, a hemolytic anemia in their blood, which can happen as a side effect of this enzyme that's supposed to be available. If they have a deficiency and they can't process the ascorbic acid or the vitamin C, and it can cause a death of a bunch of red blood cells, and that's a problem.
Wow.
So it's not, you just don't come in and plug it in.
You don't play with this stuff.
Yeah, so if you're going to do vitamin C, you should always do a glucose 6-phosphate dehydrogenase enzyme insufficiency or deficiency test. It's not that rare. It's out there. You just have to be careful about giving that IV. You don't really want to give that IV if you don't have to, but you can give all kinds of other stuff.
Okay, so say I'm going to my high school reunion and I want to look younger than everybody there. Is this something, maybe, it's kind of a vanity thing. Can we do something like that?
Well, I mean, could you do an IV to feel better?
Yeah. and like have all sorts of energy and go and out dance everybody and.
I'm gonna say, here's what we do. It's like most people get the response of the treatment in different ways. Some people just feel super energetic. Some people have no pain. Some people have chronic pain. It helps to take their pain away.
Okay.
And so you get a different response, but usually it's a positive response. Most people provides energy state. If you have energy state, you can lower things like toxins in your body because you're able to metabolize them. So if you have a low energy state, you're fatigued and tired all the time, and you want to do a few treatments of NAD prior to your reunion, I would say go for it.
Okay.
Because it would be something that would provide it could provide some significant benefit. Obviously, you want to try it out before you go, but I haven't had anybody who hasn't done the treatment before say they haven't felt great or had a significant reduction in pain or hadn't had a positive outcome. You just got to remember how fast you're delivering things like NAD. But the other nutrients, most people suffer from dehydration. That's part of the reason why people look tired and fatigued all the time.
And drawn up.
Yeah, and their energy levels inside, because they will utilize things like caffeine and alcohol, so they're always mineral and vitamin deficient. So if you can give them a lot of those things back without worrying about bioavailability and make their life easier for, because then they got to walk around with all their pills, so they got to make sure they get taken at a certain time. If I give you 100% into your blood over an hour, well, I'm saving you a whole lot of excess other time you have to spend trying to organize that for yourself.
Right.
So when would you do it? Like you said, pre-event, post-recovery, withdrawal, fatigue, post-infection, or even during an infection if you need support, immune support, okay, or oxidation reduction support, and what time of the day. I think you can deliver them any time of the day, but if you want to get your day off to a good start, you probably want to do it in the morning.
Sure.
Yeah, sometimes I wouldn't give the IV late in the evening because if it provides a ton of energy, you're not going to sleep.
True.
And you want to lose that. You want to put that to good use during the most productive parts of your day.
See, you've already got my brain calculating, okay, 2 weeks before the reunions during the summer, so yeah, I'll be off from work. Okay, who, what, when, why?
Yeah, and the why would be, again, if you've got a malabsorption issue, if you've had problems getting enough adequate nutrition, just some people just don't like to eat. They don't like take supplements or pills. And they want an easier way, and they don't want to think about it. So this is a way of taking some of the I've got to worry about it out of your hands. Just like when we talk about patients coming in for hormone therapy, right?
Right.
If you're asking me, hey, I need my hormones, and I know that I need them, and they feel better when on them, but I don't like putting the cream on. I forget to take the pill at night. Can you make it easier for me? And I go, yeah. Let's insert 3 pellets around right the area around the hip area in the subcutaneous tissue. Drop the 3 pellets in there, and I'll see you in 3 months. You don't have to worry about anything. So that's the why. Make your life a little easier in that regard, and that I can give you a bunch of nutrition, put you on a schedule to make you feel better. Some patients come in on a weekly basis because it makes them feel good. And that's the reason why you do it. And then for those patients who are having malabsorption issues, while we're working on a plan to improve their absorption with probiotics and proper daily nutrition, we could do this to help implement the plan and help them feel good while they're trying to get into the steady routine.
Yeah, a lot of my friends don't understand why I go to the doctor so much. So, are you sick? No, I go to the doctor to stay well. They don't quite get the concept yet.
Yeah, I think it's historically that nobody goes see the doctor till they're miserably ill, and just like people say, well, doc, what are my labs like? I'm all, this looks bad. He goes, but I feel fine. Well, everybody feels good till they die. And so my whole response is that just because you feel good doesn't mean there's not bad stuff brewing. And so we want to be ahead of that. And why not keep you healthy instead of keeping you sick?
Right.
Because I keep you sick and I shouldn't say that, but you can stay sick and we can treat you, but you're always sick. Does that make sense?
Right. Rather than fixing it, you're masking it, or you're putting a Band-Aid on it.
That's right.
Yeah.
And in this concept, we're pushing past it. We're trying to go backwards. We're trying to fix it so that you have a better outcome, more better quality of life, feel better, more in control of what's going on in your life. Educate you. Because if you know more, then you can apply some of those principles, and you can be your best advocate for yourself. This isn't a replacement for a good diet. Okay.
Right.
And this is used as basically a supportive structure for patients who need a little help while we're trying to figure out what we're trying to do. Obviously, I want to advocate a good nutrition diet every day, but you and I both know every day we get a little older, we become a little bit less efficient at getting all the things that we need. So that means a whole lot more nutrients and pills or powders every day you're taking, and people just don't want to do that sometimes. So If every once in a while you come in for an IV and it works for a couple of weeks and you feel fantastic, that's okay too. But we just want to do the precursor testing. People ask me, well, what are the side effects, Doc? What are the side effects? Well, if I put an IV, put you a Myers cocktail, about 20 seconds into it, you're going to taste that riboflavin in your mouth. That nice
Okay.
vitamin taste, that you get. And so I tell you, you taste the vitamins sometimes, because it smells like when you taste them, it's just like, the ones you used to take and you burp up, but you can taste it in your mouth because it's in your blood. And so that's a side effect, but it's not a bad one. If you deliver some of those supplements too fast, patients may not feel well. So it's obviously, you should never be a rush to get in to get an IV. The whole point is this part of a nice, relaxed process. You want to feel good. You want to feel it. You want to feel the treatment going through you. And so you want to deliver it in a way, an environment that patients are actually enjoying it. Whether we're here and we're watching a little TV or listening to some music, relax. We can put some goggles on you, or or put some night light or some shades on your eyes so you can take a little nap. Doesn't matter as long as you're enjoying the moment.
Okay.
The whole idea is to make it as painless as possible. We obviously do a sterile procedure, so we sterilize the area, put the catheter in, and then we thread it to one of the IV bags over there on the counter. And it just depends on how much product you're getting, because we need to dilute it out, the products that we're giving to you. Because sometimes if you give too much concentrated products, it can irritate depending on how big your veins are.
Mm-hmm.
Again, that never happens, but it's something we need to think about as a side effect if you're getting too small a vein. And so you always want, and you want to think about things like extravasation. Extravasation would mean that you miss the vein and it goes to the subcutaneous tissue. That is a very rare event, never happens, but it's something you need to be part of the protocol the patient needs to understand. If it is, you just pull it back out and you put it back in. But my whole point is that you need to be aware of it. So we put the IV catheter, it takes about 10 seconds in, we thread it to the IV line, and we start to flow.
The idea, I've just now gotten used to getting shots without freaking out, but I can't imagine. So you leave it in for like 3 hours?
Not well. Some people do, but most of the time, depending on what treatment you're getting, you can get it done in a lot less time than that. Like if you get vitamin C, you can do that in like 2 minutes. Okay, depending on how fast you want to give it. But
okay.
I like to give it in a bag and give it slowly over time. But you can put it up here in the antecubital fossa here, or you get one of these nice veins here. One of these. Well, the cephalic vein right here works pretty good too. So these are good veins too. I do like the antecubital fossa because you have usually multiple veins there you can hit, and those are good because they're bigger bore, so you can flow it a little faster if you need to. But it just depends on the preference of the administrator.
Okay.
And usually over very quickly, and when we're done, we stop everything. We disconnect with some pressure there, put a little Band-Aid with a cotton ball on there. Have you bend your arm? You wait about a minute. It coagulates, and then you should have no problem. You can repeat it the next day on a different vein or one similar in your arm. Just depends. It's really not that traumatic, but people get spooked out by getting, the blood drawn. But, it's for the people who obviously don't have those symptoms. But if you're dehydrated, you have no choice. Where you're gonna go to the hospital. You're gonna wait, I don't know how many hours to get an IV and get treatment, or you're gonna
bite the bullet and do it here. Yeah, no. When I had to go for the stress test over at the cardiologist last year, and they left that in my arm, I was not a happy camper because I didn't know what to expect.
Right, and you didn't get enough. Nobody talked to you long enough. What's going on?
Right.
And the whole point is having good communication with the patient.
Absolutely.
As soon as you're done with the IV, you want to pull them out. If you're going to keep an IV in there, like what they call it, and the hep lock, it means that they put a little heparin in there so it doesn't coagulate. The whole idea is deliver the treatment and get out. Okay, that's what we normally do. But when you leave an IV in there, in that regard, because you plan on giving more medicines or something like that, and in this regard, we're not doing that. We just deliver the treatment and we get out.
Okay.
But you see places like this all the time in Vegas, advertise, the morning after.
Oh my gosh,
right?
I never realized.
Yeah, they do this all the time. That became more faddish probably the last maybe 5-6 years, and now they have places popped up all over the place. And I make no claims as to curing anything, but I do make a claim that I'll make you feel better.
Yeah, last time I was in Las Vegas was for the A4M convention a few years back. I hope we get a chance to go this year.
Yeah, it'll be there.
But it was Christmas time, which is great because of the places are decorated so nice, and we went to the Bellagio and had the brunch, and before we headed back to Fresno. So I wasn't paying any attention to any of those type of places. That's just amazing.
Yeah, well, usually come out your, you come out your hotel room or into the hall, into the shopping areas, and you'll see the little pop-up booths there for your IVs. And they
Wow.
can give you, here's like they can give you a multitude of different treatments. And in my clinic, the doctor, which is me, puts your IVs in and delivers the treatment, and I check on you. Nobody else does it. Okay, now my nurse practitioners probably do it, but nobody else does it. Just me.
Okay. Well, is there anything else that?
Now we got our sterile kit with our rubber band to get compressions. We can get the vein to pop out. Our sterile swab, a little tape to tape down the IV, and then sometimes we use syringes to draw a little bit of blood out, but I don't try to do that because I think that scares people that we don't really need it. Yeah. And then usually, if I was going to say all the products we could put in, the whole products, we fill up the whole countertop there, so we didn't pull them out. They need to be refrigerated. But the reality is there's a multitude of different items you can put in the intravenous treatment. It's just a matter of what you're looking for. We have a cocktail book, too, that tells you for whatever condition, like antiviral. And my cocktail book comes from a Tahoma clinic up in Seattle, Washington. Well, it's in Washington, it's not Seattle, but and where they've come up with a lot of these different treatments. And so they have a published book, and we got it through my IV therapies course many years ago. And so they have recipes for different treatments, for different things.
Interesting. It's almost like going to a juice bar and saying, well, today
exactly
I'll have the carrot juice and the wheatgrass and a little bit of celery juice. Wow.
Something like that. And people say, well, why can't I just eat it? You can eat it, but I don't know how much nutrient you're going to get out of it.
Yes. It's amazing. The things that the average person just does not think of on a day-to-day basis at all.
Well, yeah. I guess you got to watch for it. Watch for it. And if you maybe see it on your show, or maybe there's a little pop-up regarding like information, a little infomercial about those. But, clinicians who do IV treatments usually don't tend to advertise big. It's kind of more of a word-of-mouth thing. Because we're marketing for long-term. Something that you enjoy. It's not a slam bam kind of get in and get out, and like one of those things you come in a regular basis. You could do that for patients who need some help periodically, but the goal is to have a steady regenerative program or replenishing program to help support your immune system or your nutritional status for various reasons.
Okay. All right. Well, thank you so much for informing me of this.
Yeah, my pleasure.
Yeah.